Hey, Dr. Jeff LaCour, ENT physician with Compasio Medical. Are you someone that struggles with recurrent nosebleeds? Well, let's learn some tips to help break the cycle. So where do nosebleeds start? 90 to 95% of nosebleeds are going to come from the front of the nose right here. You can see the nasal septum right here with the crusting and also down low. And what happens is the nose will dry up, the crusting will form, the crust will fall off, and the nose will start bleeding. Usually after adequate pressure, the bleeding will stop, leaving a blood clot and more crust. What happens after that? A hard nose blow or sneeze will force that crust off of there, and guess what? You're bleeding again. So how do we prevent these nosebleeds? The best thing to do is to provide adequate moisture to the inside of the nose. My personal favorite is lanolin ointment. Lanolin ointment is an oil from sheepskin. Now, if you're allergic to animals, this is probably not going to be for you.
No.
But what I typically do is I get a little lanolin ointment and I put it on my finger. And I only go to the first crease in my little finger. At night, I'll rub a little bit of lanolin towards the inside of the nasal septum on both sides, okay? During the day, what I'll do is I'll have patients use some saline gel, which you can squirt into the nose. I'll have them pull their cheek and squirt a couple of sprays on each side, and I have them do that numerous times throughout the day. The goal is you want to adequately moisturize the inside of the nose, and what happens is that will allow the crusting of the inside of the nose to heal. All right, so what happens if you've done all those things and you're still having nosebleeds? Well, take a look at this patient. This patient has a prominent vessel right here. You can see it, I'm kind of outlining it right here. And notice there isn't any crusting right there. So if this patient has a strong cough or his blood pressure goes up, he's going to have a nosebleed there. So if this keeps happening, you should see your ENT provider because you may require a cauterization like this patient. Let's take a look. After anesthetizing the inside of the nose with some cotton ball with gel, we use this little silver nitrate stick right there, and you can see that we're actually cauterizing this part of the nose where that big vessel was, okay? This is not electric cautery, this is just a chemical cauterization, and this typically can handle most anterior nosebleeds. Thanks for listening. For more content like this, please like or subscribe to our channel.